Hello and welcome to your program of choice, Health Affair on AIT, a platform where we focus on critical health challenges, issues of women and children, with a view to finding lasting solutions. I'm your regular anchor, Ushuomowa Daniels. We'll be focusing on reflections from the 2021 World Day for Safety and Health at Work celebration, the lessons learned, and what should be put in place to ensure that health workers and others in corporate organizations are protected in the line of duty. As is usual of us, let's take you through our new segment. First, member countries of the World Health Organization have come up with new resolutions on non-communicable and infectious diseases after the 74th World Health Assembly. Some of the resolutions include strengthening local production of medicines and other health technologies to improve access to health care, strengthening health sector capacity to prevent and respond to violence against children. Every year, about 1 billion children, according to WHO statistics, are affected by physical, sexual, or psychological violence, suffering injuries, disabilities, and death. Member states were asked to raise priority given to the prevention, diagnosis, and control of diabetes and access to insulin. More than 420 million people are living with diabetes, a number expected to hit 578 million by 2030. Delegates at the 74th World Health Assembly also noted that 1 in 2 adults living with type 2 diabetes are undiagnosed. Resolution also aims to reinvigorate efforts to end malaria, a preventable and treatable disease that continues to claim over 400,000 lives each year, especially children under age 5. Addressing risk factors of oral health diseases, adoption of global targets for effective coverage of refractive error and cataract surgery, reduction of HIV, viral hepatitis, sexually transmitted infections, and neglected tropical diseases also came to the fore.
Tobacco causes 8 million deaths annually. Evidence released by the World Health Organization also showed that smokers are likely to develop severe disease with the COVID-19 pandemic compared to non-smokers. With the 2021 theme of World No Tobacco Day, Commit to Quit Tobacco to be a winner, experts from across the world are calling on smokers to take advantage of the celebration to live healthy.
This is a day dedicated by the United Nations and promoted by the World Health Organizations to encourage nations to promote non-smoking of tobacco. Almost about 10% of the adult population in Nigeria smoke tobacco. And this is growing. It used to be less than 10% before. But since 2015, the data we have that tobacco smoking, especially among youth, is going up. And almost about more than 10 million populations are smoking tobacco in Nigeria. Well, we do know that tobacco endangers all parts of the body, but mostly the heart and the lungs. And is out of 7 out of 10 cancer of the lungs is due to tobacco. So tobacco damages the heart, it increases the blood pressure, it causes heart attack, it damages some of the small vessels of the legs and can cause gangrene of the small vessels of the leg.
Enforcing bans on tobacco advertising, enforcing bans on tobacco sponsorship. We do know that the tobacco industry is very interested in young people. A lot of their activities and their adverts are geared at what young people like. What do young people like? They like music, they like fashion, they like fun. And then when they present tobacco in that light, and now we are seeing real big problems with shisha. So now shisha is seen as a glamorous thing, a cool thing, a bonded, shared experience for young people. So what we need to do to prevent initiation will be to focus on the youth. Everything that can be done at home, at school, in the environment, that would reduce initiation or help young people not even think of starting smoking at all is definitely the way to go.
For everything in life, the Holy Book says there is time and season. For the Lagos State branch of Pharmaceutical Society of Nigeria, Sunday, the 30th of May 2021, was a day of award for individuals who have put in so much for the advancement of the association and humanity. The 2021 annual luncheon also provided an opportunity for a 50 million fundraising for furnishing and completion of the PSN State Chapter Secretariat.
The annual luncheon program of the society remains the bedrock of the financial strength of the society. It helps us to complement the contribution of the members and drives our major projects. This year's event is hosting the conferment of the Merit Award of Honor of PSN Lagos State Branch on 66 of our worthy and deserving members for their consistent and distinguished services to PSN Lagos State Branch and pharmacy profession in general.
You're a very hardworking woman, and you love pharmacy, and you put your best. Congratulations. Award and recognition of your meritorious and outstanding service to the PSN Lagos State Chapter as one official member 2017 to 2019. Congratulations.
This Academic Excellence Award emerging as the best graduating student of the Faculty of Pharmacy, University of Lagos in the 2018-2019 academic session.
We must congratulate the Pharmaceutical Society of Nigeria Lagos State Branch. It's certainly not anything easy to organize a program of this magnitude against the current realities of COVID-19. Businesses are not running optimally, and you've put together a fantastic program. People have managed to observe COVID-19 protocols. It's also been a financial success in terms of returns on investment. So we must congratulate the PSN Lagos State Branch for a very good outing.
For such a gathering with major players in the pharmaceutical sector, we took up the PSN President Manzi Sam Ohambua and former PSN President Olumide Akintayo on trading issues.
Today, the main issues confronting pharmacy are the issue of how to get a proper legislation to ensure that we are more able to ring fence and sanitize the pharmaceutical space. That still remains the primary problem, because inability to properly ring fence the space and regulate it appropriately, leads to a lot of problems with, that affect the health of the people. You talk about the issue of substandard products, what they call counterfeit, counterfeit products, is still preeminent because of the porousness of the space. We also find an issue of wrong, or what you call drug abuse or drug misuse, still rampant, because the space is still being infiltrated by people who have no reason to be there except they are looking for commercial opportunities. And dealing with medicine is not a commercial work.
There's been a lot of uproar about NAFDAC reducing pharmacy practice to an income-generating template and all of that. I just think, a discourse has been created, and I believe that appropriate machinery is being put in place within and outside the profession, so that some of these thorny issues can be resolved in the best interest of consumers of health. We must continue to insist that each of these agencies sticks to its area of core competence. And of course, once we do that, I believe we can regularize and redress whatever the perceived aberrations are.
The Lagos State government has continued to strengthen its response to the COVID-19 pandemic with a resolve to mitigate the possibility of a third wave. Lagos State has tested over 495,339 COVID-19 samples, with 58,975 of these samples confirmed positive and 356 deaths. On March 12, 2021, the vaccination campaign was flagged off in Lagos with a total of 317,916 people vaccinated so far with the first dose of the Oxford AstraZeneca vaccine. The state on Friday, 28th of May 2021, commenced the administration of the second dose of the Oxford AstraZeneca COVID-19 vaccine. Given the requirement for achieving herd immunity, which is 60% of the total population, Lagos State still needs to vaccinate about 14 million people to reach this target. The Lagos State government has also put in place strategies to implement mandatory isolation for inbound travelers into the country from India, Turkey, and Brazil. It is worthy of note to state that the new Coronavirus Act of 2021 empowers Mr. Governor to quarantine anyone he deems fit for any period of time. The Act also empowers him to sanction every individual with fines of up to 500,000 or imprisonment of up to 5 years.
The theme for the 2021 World Day for Safety and Health at Work on the 28th of April, Anticipate, Prepare and Respond to Crisis, is thought-provoking. Heroines like Stella Adadevo, who paid the supreme price in the course of working to save humanity, were remembered. But how well are those still alive and working, imbibing the lessons of that theme? What can Nigerian government and workers themselves do to promote occupational health and safety? I spoke with an expert, Ide, on this topical issue.
Let's take it from the history. World Day for Safety and Health at Work was a day that was set aside by International Trade Union Congress to remember their members who worked and died at the course of work. So it started in 2003, and that's when ITUC started celebrating it. But ILO saw it as a very noble idea, and ILO decided to come into it in 2006 to join ITUC to adopt this program and start marking it worldwide. And what ILO was looking at is, instead of us just remembering those who have worked and died, what about those who are in the workplaces that are still working? Why not help them, celebrate them, help them, teach them good work practices, how to prevent accidents, and how to stay alive while they work? And that's why the day became a world day that we celebrate across the world. But if you look at this year's theme that talks about prepare, anticipate, and respond to crisis, we've seen it was the theme was taken in line with the COVID-19 disruption in workplaces, which of course brought every nation across the world to its knees, and we're still recovering from that right now. And again, also advocating on how we can invest in resilient system. We don't take occupational safety as issues that will give priority across countries, in both country and enterprise level. But when the COVID-19 came, we realized how much we needed occupational health and safety experts and their expertise to build back better in different countries. So we're looking at let's celebrate it and let's bring this to the front burner. But which of course it was a very good celebration across the world. We saw videos, we saw countries across the world. For the first time, we saw people really coming en masse to mark this day. I'm sure based on what they saw that happened with COVID-19, and everybody doing what they can do in ensuring that they can anticipate crisis and they're able to respond when it happens. They actually implemented to the last letter. We must learn as a country, like the team said, anticipate and prepare. Nobody services rifle in the face of war. And we had Ebola here many years ago. The lessons we learned from Ebola would have been enough for us to combat, to at least respond to COVID-19. I tell you the truth, once COVID-19 goes right now, everybody goes back to their where we're coming from, and the lessons learned, we forget them immediately. And that's one thing we've always done. So when it happens again, we start reinventing the ways. We shouldn't. We should learn to sustain the tempo, what we have learned. Let's have a preparedness plan. But I'm happy to a great extent. I mean, when you see NCDC right now, I don't know if it was because they were there before, but the COVID-19 took them to a very high level, which of course that's one of the gains we must celebrate in this country, that COVID-19 also helped us. So that there are processes right now, there are guidelines for different sectors, and this we never have. But even in the midst of this, let's not forget that pandemic comes and goes. This one will come and it will go at its own time. But let's have in mind that we will still have more infectious disease outbreak or medical emergency disease that will come to us in this country. We must have a plan, a response plan that we put in place for that. We don't start running around when we have the disease here with us. And that's what will happen. You saw when Nigeria shut down as a country, when the countries across the world where there were spike of COVID-19, where they were showing that their country, Nigeria, left their borders open. And the next thing we saw, we had COVID-19 in this country. So the truth is that we need to learn to anticipate and learn what we can say, yes, we are closing out right now. But that I just mentioned to you earlier on that now we have the spike of COVID-19 we have in India, we have in Turkey, we have in Brazil. And now people still come from that country, they come to this country, and some of them may not even be checked. Firstly, we need to start looking at national legislations, even whatever you have there as Factory Act. I mean, I think that's an obsolete document that should be repealed and reviewed to meet up with the new reality of accident risk in the workplace. But I'm happy. I mean, even while we look at the ills, let's also look at what some set of people have done lately. I mean, I think about 2 weeks ago, I saw a document that was emailed to me by Ministry of Labour and Employment, which of course, there is so much hope in that document. And for the first time, I'm seeing the ministry being able to actually look at occupational health and safety holistically in the context of our country. And when I saw that document, I was very happy. I made my input, I sent it back to them. But I do hope that the content of those documents, though there were timelines where everything will be achieved, I just hope that document we are able to actually achieve what was documented in that piece of work. If we're able to actually implement those things, I think we will say for once we have at least guidelines that can actually guide Nigerian people in the place of work. For the first time, I was seeing Nigeria talking about Occupational Health and Safety Research Center. We never heard of that before. For the first time, I saw Nigeria talking about occupational hygiene. We have in Nigeria, if we want to talk about occupational hygiene, we are less than 10 for a whole country. So these are some of the areas we must give attention to. Seeing Nigeria talking about setting up occupational hygiene laboratories across several regions of the country. Seeing the country talking about the document talking about the introduction of occupational safety even at school level. I mean, being part of what students should be studying in school as part of their courses. These are very good developments that we should celebrate government for. But one thing we're looking at is the possibility of following this track to the end and ensuring that what were documented in that piece of work, they actually implemented to the last letter.
Beyond government policies to enforce occupational safety policies in workplace, what should the employers be doing? What should be the role of employers?
Most companies that are set up in Nigeria, there are no guidelines. When you're going to set up a company in Nigeria, as you are coming in, first thing that should be given to you is government guideline on safety and health and environment on how to set up a company. When we have such a document in place, it will be a good step to go. So we need that. So not just people coming in, want to set up a biscuit manufacturing company in Nigeria, everybody's clapping hands for those people. They want to set up a biscuit manufacturing company, but without taking into cognizance how many people are going to die for us to eat biscuits in this country because they have to work in those companies. And these are the things we should be looking at for. Government hasn't really done much as far as I'm concerned. But I think it's not too late for us to rise up as a government, as a nation, and start doing what we ought to do. Other countries look at Southern Africa. Southern Africa region, SADC region, they're doing that. Occupational safety is spiking in that area so much. But here, we all just lazy around. Even those companies are not compelled to implement occupational health and safety guidelines or policies. But you go to some companies like, we know about this. Because they know about this, but they don't have the system. Government is the one that will enforce it. We need this from you. When they say we need this from you, you see all the companies say, okay, we need this. Most companies don't have occupational health and safety officers, let alone occupational safety managers. And that's so disheartening. But we must give credit to Lagos State government, who didn't wait for government, but they set up what you call Lagos State Safety Commission. But look at, the ones, what they have been able to do in Lagos State right now. Companies know that, yes, we have to go through a safety inspection, we have to go through this, we have to go through this. So companies are sitting up, a great day right now, because there is a regulatory body within the state that enforces health and safety guidelines across all enterprise. This is what we want government to do at the national level. Yes, doing at the state level, Lagos State government is good at that, but is it every state that have the commission? No. That's where federal government needs to wake up to its responsibility.
In the case where employers are failing us, government is failing us, what should workers themselves do to be safe at workplace?
Don't look at government. Don't look at Mr. A or Mr. B. You know what the protocol is. You know what is right from wrong. You want to be safe. You must make it personal. Your nose mask, wear it. Even if nobody wears nose mask anymore, let it be that it is you alone that wear nose mask. Because when you wear nose mask, you get protected from kind of aerosol infection. You get protected. When you get to where there is water, wash your hands. If you don't have put hands inside your pocket, you have to take it personal. Do not wait for your government or your employer. To stay alive is your personal responsibility.
Thank you very much for coming on the show. We appreciate you.
My pleasure.
If you are just joining us, the program is Health Affair on AIT. Now I'll be taking you to our nutrition segment.
Pawpaw, also called papaya, are large oval-shaped greenish fleshy fruits that are grown in many parts of the world. They have a mellow taste and are greenish when unripe, with a hard pulp, and yellowish amber or orange when fully ripe, with a very soft flesh. Pawpaw plants grow in 3 sexes: male, female, and hermaphrodite. The male produces only pollen with no fruits. The female produces small fruits when pollinated. The hermaphrodite can self-pollinate, since its flowers contain both male stamens and female ovaries. Almost all commercial pawpaw orchards contain only hermaphrodites. It is widely cultivated throughout the world, especially in tropical countries of the world, but its origin is in the tropics of the Americas, from northern South America through the Central America to southern Mexico. Because it is widely grown in many countries of the world, it is very popular and has diverse uses in many cultures. All parts of pawpaw tree, the seeds, the bark of the tree, the leaves and fruits are edible and are used in one way or the other. In traditional medicine, pawpaw leaves are used as treatment for malaria, as a purgative, and also used to relieve asthma. It is also used in many cuisines all over the world. The unripe green fruits can be eaten when cooked, but the ripe fruits is usually eaten raw. The black seeds of pawpaw are also edible, and they have a sharp, spicy taste. Green pawpaw is used in Southeast Asian cooking, both raw and cooked. In some parts of Asia, the young leaves of pawpaw are steamed and eaten like spinach. It is also very popular among the Filipinos, Indonesians, Brazilians, and Americans. In 2018, global production of pawpaw was 13.3 million tons, led by India with 45% of the world total. Global production of pawpaw grew significantly over the early 21st century, mainly as a result of increased production in India and demands by the United States. Raw pawpaw pulp contains 88% of water and also rich in carbohydrates and vitamin C. A 100-gram serving of raw pawpaw contains energy 43 kilocalories, water 88 grams, carbohydrates 10.82 grams, sugars 7.82 grams, dietary fiber 1.7 grams, fats 0.26 gram, protein 0.47 gram, vitamin C 67 milligram, 75% of daily value, vitamin B9 38 microgram, 10% of daily value. Potassium, 182 mg, 4% of daily value. Magnesium, 21 mg, 6% of daily value. Calcium, 20 mg, 2% of daily value. Iron, 0.25 mg, 2% of daily value. Manganese, 0.04 mg, 2% of daily value. And lycopene, 1,828 microgram. Purple skin, pulp, and seeds contain a variety of phytochemicals, including carotenoids and polyphenols, which are a dietary source of antioxidants that can reduce inflammation, fight diseases, protect against skin damage, improve heart health, improve digestion.
On our clinical segment, we give you tips for healthy living.
Infertility is a major issue in a country like Nigeria, and all over the world, fertility is an issue. We know that it affects about 1 in 6 couples at some point in their lifetime. The couple should be investigated together. That's both the man and the woman. And it's not a question of blame. Sometimes these things happen not because of what somebody has done, but just, but the most important thing is to be aware that, for infertility, there are treatment options. There are effective treatment options. And, the couple just need to access the right facilities. And it's not all about IVF. You don't need IVF for every case of infertility. There are some cases that, lifestyle changes, personal advices, drugs, or some operative procedures.
To be a part of our perception segment, please reach out to us on the phone numbers showing on your screen or through our social media handle.
Healthcare delivery system of the country appears to be dangling in mid-air. And as far as we are concerned, it could drop and explode beyond repair any day, except something is done and done urgently. Anywhere in the world, the economy, the success or failure of any nation is in the private sector. Taking a cue from that, the health system is also in the private sector. But this private sector, for the first time in our history, we want to bring together. Let us establish a blueprint, a document, a communique for Nigeria. That communique at the end of the day will be delivered to the National Assembly and to the federal government of Nigeria.
This is where we draw the curtain on the show today. Thanks for spending your time with us. Please let's do it again, same time next week. My name is Ushuomowa Daniels.